there, my friends. Welcome back to another session on TB discussion. Today we are going to dive into the TB HIV information package. So, let's start by understanding what TB is. TB is a disease caused by bacteria that mostly affect the lungs, but it can also impact other parts of the body, excluding the hair, teeth, and nails. On the other hand, HIV is a condition caused by a virus that is mostly transmitted through sexual intercourse. Now, the important thing to note is that TB can affect everyone. Young, old, men, women, the rich, and also the poor. But here's the good news. It's curable. HIV, on the other hand, can be passed from mother to child through the sharing of contaminated needles or razor blades, as well as through direct contact with infected blood or other body fluids. Guys, when it comes to how TB is spread, it happens through droplets in the air from an infected person with TB disease. So, when that person coughs, sneezes, sings, or spits openly, a healthy person can breathe in the bacteria. Yes? Now, let's talk about prevention. To prevent TB, you can take a few steps. 1. Avoid sharing an enclosed space or room with a TB-infected person. 2. Say no to smoking and alcohol consumption. That one reduces your immunity. 3. Don't live or work in dark, poorly ventilated and overcrowded rooms. 4. Minimize interactions with people who have been in high TB disease areas like refugee camps, mines, and alcohol dens. My people, maintain a balanced diet and exercise regularly. Protect young and elderly people from exposure to tuberculosis because of the immunity issues. Properly manage chronic illnesses such as diabetes and hypertension. Make sure to undergo routine screening for TB if you are living with HIV. Keep in mind that TB cannot be transmitted through common activities like shaking hands, sharing utensils, touching beddings, or using the same toilet as infected person. Yes, my people, let's talk about who is at a greater risk of developing tuberculosis. Here are the most vulnerable groups. 1 is people sharing an enclosed space or room with an infected TB person. 2, individuals living and working in dark, poorly ventilated houses. People living and working in overcrowded places. Those who have moved in or out of areas with high TB disease, such as prisons, refugee camps, gold mines, and also alcohol dens. People with malnutrition. Young and elderly individuals due to their lower immunity. People with chronic illness like diabetes. Guys, also hypertension and even other diseases that have low immunity. People living with HIV. To ensure proper care, it's crucial that all people you live or regularly interact with, at home or work, visit the nearest health facility to get screened for tuberculosis. So, how does the diagnosis of TB work? Well, it starts with screening and testing individuals with TB symptoms. If you exhibit symptoms like cough, actually in adults, reduced playfulness in children, fever, night sweats, weight loss, and more. It's important to visit a health facility for TB testing. Now, when it comes to testing, various options are available, including laboratory tests on sputum or other body tissues, as well as x-rays. Sometimes a person can have TB even if the TB tests come back negative. This is what we call extrapulmonary tuberculosis. In case you are diagnosed with TB, here is what you need to know. The doctor will prescribe the appropriate TB medication for you. Stick to the prescribed medication, taking it at the right time and regularly according to the doctor's advice. Don't stop taking your TB treatment even if you start feeling better. Complete your treatment plan, which usually lasts for 6 to 12 months. Remember to collect your TB medication weekly for the first 2 months, then every 2 weeks for the rest of the treatment period, unless a doctor advises you otherwise. Always inform your doctor about any other medication you are taking for proper management and guidance. If you are on hormonal family planning, talk to your doctor about the methods you are using. The doctor can advise you to incorporate a barrier method like condoms. Your TB medicine will be given based on weight. Consider joining TB patient support groups for additional support at your nearest health facility. Guys, make sure your close family or friends get screened for TB. Those found to be free of TB may be given preventive therapy, TPT. While on TB treatment, avoid alcohol, herbal medicine, hard drugs, and also avoid smoking. If you are living with HIV and have TB disease, discuss TB prevention medication with your doctor once you complete your TB treatment. Yes. Now let's look at what the TB treatment journey entails. Usually, the treatment duration is 6 months, except for cases of TB in the brain, bones, and joints, which may require treatment for 1 year. Drug-resistant TB treatment takes around 18 to 20 months. So, we can avoid going to another step when we take our drugs as required. There are a few prevention measures to follow. Remember to cover your mouth while coughing. Open windows for ventilation. Spend more time outdoors when possible. And avoid spitting on the floor. Regular follow-up sputum tests are recommended at the end of the 2nd, 5th, 6th month or as advised by your doctor. These tests help monitor your response to treatment. Sure, guys. To make your TB treatment journey smoother, there is some support you can rely on. One of the support is identify and inform a treatment supporter, a family member, or a friend who can remind you to take your medicine. Of course, these people will assist you to remind you with the treatment appointments and even provide social support. Ask the people you live or regularly interact with if they have any TB symptoms. Encourage them to see a healthcare professional if actually needed. Take care of your health by consuming health diets, 3 meals, 2 healthy snacks, and plenty of water. Consider taking micronutrients supplements if eligible. Remember to avoid alcohol, herbal medicines, hard drugs, and smoking while on TB treatment. Yes, sure guys, stick to your treatment plan and complete it as advised by your doctor. Don't share your TB medication with anyone, as it may reduce the correct amount you need for a speedy recovery. If you experience a challenge in urine color, don't worry. These are common side effects of TB treatment. Just continue with your medication. However, if you experience shortness of breath, skin rashes, itchiness, yellow color in your eyes, or burning sensation in your hands or feet, inform your doctor immediately. Yes, people, my colleagues, my friends, I want us to cover some of the frequently asked questions about tuberculosis. One of them is, does having a TB mean I have HIV? Not necessarily. You can have TB without HIV, and you can have HIV without tuberculosis. It's also possible to have both diseases at the same time. The only way to know your HIV status is through testing. Another question is, can I get infected with TB after being treated and cured? Yes. If you are exposed again to a person with infectious TB, it is possible to get infected again. That's why we emphasize on contact tracing. If I have TB, does it mean I also have HIV? I can say no. The germ that causes TB and HIV are different. However, having HIV increases your chances of developing tuberculosis because there are issues with immunity. What should I do if I miss a dose of TB medicine? One thing I can advise you is take the missed dose as soon as you remember and report the number of missed doses to your doctor, and the doctor will advise you. Another one is it safe to take TB treatment during pregnancy or while breastfeeding? Yes. TB treatment does not interfere with pregnancy or breastfeeding. However, it's important to inform your healthcare provider if you are pregnant or breastfeeding for support and guidance. My people, another question. What can happen if I fail to complete my treatment? Guys, failing to complete your treatment can lead to drug-resistant tuberculosis, which is more difficult and expensive to treat. The treatment may fail and you can become sicker. You may also continue to infect more people, be forcefully confined in a hospital until treatment is completed, or face the risk of death. Yes. Another one is, can I continue with my regular work activities while on TB treatment? Yes, you can continue with your usual work activities. However, your body may need rest in the first 2 weeks. So you may need to avoid strenuous activities during that period. Guys, you can also ask me questions in a comment section. Other questions are, can I get TB after receiving the BCG vaccine? Yes, you can still get TB even after receiving the BCG vaccine. The vaccine mainly protects against severe forms of TB disease. Lastly, let's debunk some myths about tuberculosis. What is the first myth? TB is generic. The fact is, TB is primarily transmitted through the air. It can spread from person to person within the same household. Another myth is, TB is caused by witchcraft. The fact is, TB is an infectious bacterial airborne disease that has nothing to do with witchcraft. Another myth, TB has been eradicated in Kenya. The fact is, Kenya is still among the countries with high TB burden. So let no one lie to you. Another one is donkey milk or certain foods can treat tuberculosis. Guys, only TB medicine provided at the health facility can effectively treat tuberculosis. Another myth, TB only affects smokers. The fact is, TB can affect anyone, but smokers are at a greater risk because of their reduced immunity. Remember, TB cannot be transmitted through common activities like shaking hands, sharing utensils, touching beddings, or using the same toilet as an infected person. Similarly, HIV cannot be spread through touching, sharing utensils, kissing, insect bites, or toilet seats. Guys, thank you for listening. But before you go, make sure you subscribe to the channel at Nandi Empress. Like, share, and leave a comment. See you next time.